What you need to know about genetic treatments. There are two types of genetic treatments: gene therapy and gene editing. Genetic treatment approaches aim to correct the defective genes by either supplying entire normal genes to compensate for the defective ones, gene therapy, or by replacing specific genetic mutations with normal genetic information, gene editing. Of these approaches, gene therapy is currently at the forefront of medical treatment. Current clinical trials for retinitis pigmentosa utilize gene therapy. These trials are all very promising. The only FDA-approved treatment of retinal disease utilizes viral gene therapy to restore useful vision in patients with blindness due to Leber congenital amaurosis, a condition similar to retinitis pigmentosa. Despite the success of gene therapy, significant limitations exist. Gene therapy approaches, most used in clinical trials, are only theoretically able to treat a specific subset of genetic diseases. Many of the most common and devastating forms of retinitis pigmentosa and other retinal dystrophies remain out of the reach of standard gene therapy techniques. Gene editing might offer the most hope to people with retinitis pigmentosa. Both approaches use a gene delivery system, which has a size limit. Gene therapy cannot handle the number of new genes needed to treat the disease best, Roller explained. Since gene editing modifies the existing genetic information, a size limit does not apply, greatly expanding the range of treatment options. Anything that can be done to help patients with retinitis pigmentosa would be a fantastic advancement in our treatment. Retinitis pigmentosa causes vision changes and vision loss early in life, making everyday activities, like navigating a room or a hallway, very difficult. Having a treatment to stop the progression of the disease would be wonderful. However, there are issues with bringing gene therapy and gene editing to everyday healthcare. A significant problem is the cost. Major concerns in the development of gene therapy include expense, with today's price tag often in the millions of dollars for treatment of one patient. Searching for techniques to reduce the transmission of genetic disorders is just as important, if not more important,